hernia is basically a hole. It's a hole in the muscles of the abdominal wall. They occur more frequently spontaneously in men than women, primarily in the groin. The other cause of hernias that we see frequently is they can be incisional. If you've had previous surgery, it weakens the muscles of the abdominal wall. That can develop into a hole over time. The common symptom that we see with hernias is bulging. You see a bulge either at a previous incision, or in men you see bulges in the groin. Those bulges are essentially the fatty tissue and the bowel from the inside trying to work its way out. And that's where hernias can be problematic. Hernias can get what's called incarcerated, where you get bowel stuck in the hernia sac. If the bowel gets stuck, it becomes an emergency to fix. Otherwise, the bowel can slough and die, and then it becomes a big emergency and a much bigger case. So we really try and get a hold of people with hernias before they get to that point. Women present a little bit differently with hernias. Oftentimes it's very difficult to make the diagnosis in women because they do present with vague symptoms of abdominal pain, discomfort, sometimes nausea. So it's a lot harder to make that diagnosis. Now, umbilical hernias or belly button hernias, women get those very frequently after pregnancy. And those are fairly easy to diagnose and fairly easy to surgically repair. Traditionally, repair of hernias involves a big incision to fix the hole and patch the hole. If you think of it as just like a hole in your drywall, that's essentially what a hernia is. You have to put a patch on it. And so that's what I do. I patch it with a piece of mesh. And traditionally, we'd have to make an incision in order to delineate the hole and put the piece of mesh in. Nowadays, I can do this with minimal incisions with robotics, and it's somewhat paradoxic, but I can actually see better and put a much larger piece of mesh in through much smaller incisions. I can roll the mesh up, put it in through smaller incisions, and really use a much larger piece of mesh than I could traditionally use with an open incision to patch the hernia defect.